Okay, so we'll get started. Okay, so cervical fascia, lymphatics of the head and neck. So this is a super dense paragraph, so some things that I wanted to point out because I got to skim it before we started. Important things are the cervical fascia. It has 3 layers, and cervical fascia and deep cervical fascia are the same thing. It's just 2 names for the same thing. So the 3 layers are the investing layer, the pretracheal layer, and the prevertebral layer. If you've seen pre, that means like before or in front of. So prevertebral is in front of your vertebrae. Pretracheal is like in front of or anterior to your trachea. So let's see, other important things. All 3 of these layers contribute to your carotid sheath. And your carotid sheath, and there's going to be a picture that shows this later, but I'm going to keep repeating this because you need to know what's actually in your carotid sheath. So your carotid sheath includes both your common and your internal carotid arteries, as well as your internal jugular vein and your vagus nerve. Let's see, what else did I thought was like, oh, this is kind of important. You're gonna be learning some more lymph drainage because, you know, actually in the title of these slides. I think those were like the big things just to start off. And then just like they list the lymph nodes, but I think it'll be better for you guys to see it in pictures rather than as a list. Okay, so organization of the integument. So integument is, you know, medical term for the whole skin system, because it isn't just what we see on the outside. The skin itself has 2 layers, the epidermis and the dermis. So this prefix epi means on top of. So epidermis is on top of the dermis. This is what you actually see on a person, like a normal healthy person. You see their epidermis, and then underneath the epidermis is the dermis. So underneath the skin or deep to the skin is the subcutaneous tissue, and then deep to your subcutaneous tissue is the deep fascia. So skin, subcute, fascia. Okay, so again, here's your epidermis. This is what we see, you know, when we look at folks. And then below the epidermis, you see the dermis here. So notice how in the epidermis, it's mostly like skin cells that are flat, dead, get pushed up to the surface, and we use that as a barrier against microbes, use it for like temperature regulation, water regulation. So your epidermis is pretty important. However, all the good stuff, like all the things you think about starting to be a part of your skin, are down here in the dermal layer. So you can see how we have this sweat gland that's like starts down here into the subcutaneous tissue, comes up through the dermis, and then empties out onto the epidermis. You can see how nerves coming up through the subcutaneous tissue into the dermis, and then actually like here in the epidermis down where, if you look at these, I know it's not the easiest to see, but these are cells here. And this bottom row of cells is actually constantly regenerating. This basal layer, basal is like bottom. So this basal layer has your actual regenerating cells, and those cells get pushed up and pushed up and pushed up, and then finally sloughed off here. Also in like this dermal layer, you can see, so this is actually a muscle that's attached to your hair follicle. The way that your hair follicles, like your hair stands on end, there's actual muscles that pull the follicle to make them go straight. Other things here, there are blood vessels, both bringing oxygen to the tissue as well as taking deoxygenated blood away, and lymphatics all in this area. And so looking even further down, so we have our epidermis, here's our dermis, and then in the subcute is when you have the like vessels that these small branches came off of. So obviously these are bigger versus these being smaller. So when you cut yourself, if you see blood, know that you've gone past the epidermis into the dermis. And later on, probably not now, but later on you'll end up learning all the different layers of your epidermis, because there's like 6, I want to say, if I'm remembering correctly off the top of my head. And then from the subcute, deep to the subcute, you have this basement layer, and then finally you start seeing skeletal muscle. So this basement layer, this is your deep fascia. So this is the fascia investing the muscle below. Okay. So tension. When it comes to our skin, there's actual tension lines, and these are the lines of Longer. These become important when you think about surgery and trying to avoid scars or hernias. So you can see how here, there's this line that goes directly across this person's face. You can see it here. The idea is that when you cut along the lines of Longer, there's only one area or one specific line of tension that's going to be pulling along that incision. So, okay, I will give you the, for instance, that I'm going to OBGYN. I did a sub-I where I was doing benign gyne surgery. And they talked about how when you cut along the lines of Longer, when you stitch that person back up, you know that the tension is pulling along that line. So if you cut along that line, that means the tension's going to run with the incision, as opposed to if you cut perpendicularly along that line, you increase the risk for the skin not closing, for a hernia to be to develop, because you have multiple lines of tension that are pulling along the incision if you go perpendicular. So when you have a surgery, they're going to cut parallel to the lines of Longer, so that the tension is going to be the least amount possible to ensure that your patient actually has an incision that closes properly and heals properly. So that's what we mean by like these tension lines. And it's all over the body. Like there's a whole map that you can look up the lines of Longer, and it's the entire body has a map of where these tension lines are for you to know how to cut to try and avoid having like the separation of that skin when you sew them back up. Okay, so surface anatomy of the neck. So here in our drawing, you can see a couple of prominent things. So first off here is the jugular notch. So you can feel this at the base of your neck. It is like the top of where your mandible is. That's considered your jugular notch. And you can usually see it in people if they're pretty fit when they're wearing a shirt. Here is the sternal head of your sternocleidomastoid. For pretty much almost anybody, if you turn to the left or turn to the right, you can actually feel this muscle because it'll be pretty prominent on your neck. Your sternocleidomastoid muscles are important for you to be able to turn your head left and right. You can also see here the clavicular head of your sternocleidomastoid. So I mentioned this before and I'll mention it again. So the sternocleidomastoid muscle, it's one of those muscles that tells you all of the things that it's touching. So sterno for the sternum, cleido for the clavicle, which is here. So sternum, clavicle, and then mastoid for the mastoid process, which is back behind, like near and underneath where your ear is. So basically about here, it comes down and then it has its sternal head and its clavicular head. Let's see other things. So I already mentioned the clavicle. The trapezius muscle, your traps, are back here. And I'll make the note, and I'll mention again later too, that your sternocleidomastoid muscle and your trapezius muscle, they're both innervated by the same nerve. It's cranial nerve 11 spinal accessory. I'll mention this again later, but I just want to put that in there for you because learning your cranial nerves can be kind of difficult because it's 12 of them and you will have to memorize all 12. So you can see here, they've outlined how you can see the brachial plexus coming through. It's going to originate, like the roots are going to originate here, coming off of the cervical part of your spinal cord, and then coming through and then traveling through your axilla to the innervate the upper limb. You can also see here your external jugular vein, kind of prominent on this particular picture, as well as your thyroid cartilage. Okay. All right, so go away. I can't really read this because my Zoom is doing the thing where it has the bar at the top, so I can't actually read it. So I think it says organization of the neck. So here you can see a picture of your platysma. So your platysma is a muscle of facial expression. So you see how here's the skin, here's the subcutaneous tissue and fat, and then here's the platysma. The platysma is the muscle that makes you have tension in your neck. The reason why we call it one of the muscles of facial expression is that it's in, like, there's a group of muscles that all have to do with facial expression, and they're all innervated by the same nerve. They're all innervated by facial nerve. So this is like one of those muscles. You'll learn about more that are in the actual face itself, but the platysma does count as a muscle of facial expression. Okay. Really need this taskbar to go away. All right, so we're seeing some important bones in the head and neck. So some of the important bones that you're going to be learning about. So here's your mandible. Obviously, that's for your chin. There's different parts of your mandible. You'll learn that later. Here's your hyoid bone. Your hyoid bone is this bone that just sort of floats in your neck. And it's used mostly as a point of attachment for multiple muscles. And you'll have muscles that are above the hyoid bone. So those are your suprahyoid muscles. And then you'll have muscles that go below the hyoid bone. So those are your infrahyoid muscles. So supra above, infra below. Other things of note here, you can actually see your cervical vertebrae. So here is your C1 atlas. So atlas, that's cervical vertebra C1. That is the cervical vertebra that the skull is resting on. Right underneath it, C2 is axis. So they actually named C1, which is atlas, and they named C2, which is axis. And you can recall from the previous PowerPoint how in your joints PowerPoint, axis has a projection that comes superiorly out of it that actually nestles within atlas. And I believe that was your, oh crap, which joint was that? Was it pivot? I can't remember. But yeah, so here is axis, here is atlas, C1, C2. You're gonna want to remember the names. When you get more into anatomy, there are actual ways that you can identify the different vertebra of the spinal column based on just how they look, just how their shape is. So cervical versus thoracic versus lumbar. But I will not go into that until later because it's harder to see, because they actually, in other pictures, they'll compare them and show you, like, point out the differences, but it's hard to see on this particular picture. Some other structures that are important here. So here's your thyroid cartilage, and then here's your cricoid cartilage, and then finally your tracheal rings. Calling your tracheal rings is kind of, it's slightly disingenuous because the rings aren't a perfect circle. They actually make a C. So your tracheal rings aren't a perfect circle. They make a C. And then on the back side of the trachea, you have a muscle called your Trachealis Muscle. This is the muscle that allows it, that when you swallow something, when it goes through your esophagus, that bolus, that bulge that happens to your esophagus, pushes against the Trachealis Muscle and allows that bulge to go, like, to pass by the trachea. If you had cartilage that went into a perfect circle, then that would be a problem for your esophagus and you getting food past it. So we have that Trachealis muscle in the backside of our trachea to allow for, smooth passage of food in the esophagus, which is posterior to your trachea. Okay. All right, so your fascial layers here. These are all color-coded, and in a slide or two, they're actually going to be labeled. But just note how these fascia layers, they're often like continuous. And the idea is that fascia is enclosing these muscles and creating a space, again, for smooth gliding for any movement, and also trying to prevent like different areas from intermixing. You can see here, so we have, this is a transverse cut or an axial cut, depending on which term you want to use. Here is that tracheal ring I was talking about, the C's, and you have them stacked in your trachea. Here's that trachealis muscle posterior to it. Here's your esophagus. And then on either side of your esophagus, this is actually a branch of your vagus nerve. So vagus nerve is cranial nerve 12. And vagus, the word vagus actually means wanderer. And that's important because your vagus nerve goes all over your body and innervates a lot of different organs and structures. So you have vagus nerve both here as well as within your carotid sheath. So here's your carotid sheath, and here's your carotid sheath. And before, in that intro slide, it talked about how the 3 different layers all contribute to the carotid sheath, and you can see that here. So here's your prevertebral layer, so pre meaning in front of, and here's your vertebra. So here's your prevertebral layer contributing. Here's your pretracheal, so it's like around your trachea. And then here's your investing layer, all contributing to this carotid sheath. So she just has in this particular slide how fascia helps to limit the spread of infection and cancer, allows for surgical access to deep areas, supports structures, and facilitates gliding. So we already talked about that. All right, so I love pictures with labels. So you can see, oh, question in the chat. Oh, there it goes. I remember her saying something about molar. Oh, I don't know. I don't know. Unless she has it labeled on here, I don't know what she means by molar. Unfortunately, sorry. Oh, good. And now the taskbar goes away. All right. So your fascial layers and organization. Okay. So again, here is our outer investing layer, and you can see it's all the way around, and it's investing, it's surrounding these muscles. So these are like your back muscles, and then here's like some of your abdominal muscles and your muscles for your chest wall. Then here's your pretracheal going around your trachea. And then here's your prevertebral. Here's our carotid sheath. And then some of the, an important area that you're going to want to know about is the retropharyngeal space. Hold on. You said molar. Did you mean alar, A-L-A-R, for fascia? Because I know alar. Go ahead.
No, I was just going to say could be.
Oh, okay. Because the alar fascia, I believe, is this one right here in the middle. Yeah, I think I'm fairly certain this is alar fascia. And if not, there's going to be a slide that labels it, but I'm fairly certain this is the alar fascia. And then here is your buccopharyngeal fascia. So here is the retropharyngeal space. So retro means behind or posterior. So your retropharyngeal space is the space that's behind your pharynx. Your pharynx is your throat. And this area is important because it's a way for infection to travel down. So from your throat down into your mediastinum. Your mediastinum is the area where your heart is. So this is a way where you can have an infection that started off in your throat that can travel all the way down to where your heart is. So yeah, kind of important. So this is a retropharyngeal space. Okay. All right, so yes, that was the alar fascia. Okay, so so this one here is a axial cut, an axial plane or a transverse plane. This plane is sagittal, so splitting into left and right. It's still the same fascia, but just looking at it from a different angle. So before we had that buccopharyngeal fascia, we had that alar fascia, and we had that prevertebral fascia. And then that retropharyngeal space is back in here. So you can see they have it labeled. They actually have it between the alar fascia and the prevertebral fascia labeled here, versus in this previous picture, it was like this whole area. But yeah, so your buccopharyngeal fascia, your alar fascia, your prevertebral fascia. Okay. Structures in subcutaneous tissue of the neck. Okay. So again, here's our platysma, and then here's nerves branching off to innervate it. They're showing you facial artery, facial vein, as well as facial nerve coming over to innervate the area. They're also showing you the internal jugular vein within the carotid sheath. And then here's that jugular venous notch. Well, this is the jugular arch right here too. And then it's not easy to see here, but there are different branches off of, like different branches of nerves that are coming down to do innervation in this area. So like your supraclavicular nerve is here, and then your transverse cervical nerve is here. And then your greater auricular nerve. So auricular, when you see the word auricular, think ear. So greater auricular, I think of as in front of the ear, versus posterior auricular is going to be behind the ear. So auricular means ear. And then cervical always just means neck. Okay. Deep cervical fascia. All right. So they've taken off the skin and the subcute, and now they're just showing you the fascia. So here's your investing layer of fascia. They make the point here that here's your parotid gland. Your parotid gland is also surrounded by fascia. Here's your sternocleidomastoid muscle. So it started up here. It originated at your mastoid process, or excuse me, did it originate in mastoid process? No, it originates down here and then inserts on your mastoid process, because the whole point is you're pulling the head. But yeah, so here's your sternocleidomastoid traveling down. Here is the sternal part. Here's the clavicular part. And then when you cut away this muscle, you reveal the carotid sheath underneath of it. And then here's your internal jugular vein, your common carotid and internal carotid artery, and then your vagus nerve is going to be in there too. Other important points. Oh, so I was mentioning those infrahyoid versus suprahyoid muscles, and they actually show you a couple here. So sternocleidomastoid, this is an infrahyoid muscle. Here's your hyoid bone right in here. And you can sort of see how things are coming off of it coming down and then coming off of it coming up. This is about where your hyoid bone is. And then here's sternocleidomastoid. Okay. All right, muscles enclosed by investing layer of deep cervical fascia. Okay, so again, with your sternocleidomastoid and your trapezius muscle, so you can see even better, sternocleidomastoid here coming down and inserting on your sternum and on the medial third of your clavicle, and then your trapezius muscle. And I mentioned this for upper limb, how your trapezius muscle and your deltoid have those matching points of attachment on your clavicle and then coming around onto the spine of the scapula. So you can see that a little bit better in this picture. And remember, sternocleidomastoid and your trapezius muscle are both innervated by cranial nerve 11 spinal accessory nerve. Okay, so now we're looking at the neck with the investing fascia removed, and you can really see those suprahyoid and infrahyoid muscles I was mentioning. Eventually, you're going to get to a point where you have to memorize these. I don't know, did she go over these muscles yet with y'all? Because this is a really good picture for that. Yes, okay, well then we will go over those muscles. All right, so for your suprahyoid muscle, so here's your hyoid bone, and you can see all the points of attachment that are coming off of this bone that is like free floating in your neck. So first off, you can see here how there's this muscle that's attaching to the lower point. Oh, who else came into the chat? Okay, you can see how you have this muscle that's attaching to like the point of your chin, coming down, going through this little fibrous tissue. So it's like scooping through and then going back. So this is your digastric muscle. So you have, it has an anterior belly and it has a posterior belly. So this is digastric. Oh, and these muscles are paired. So you're gonna see, here's this person's right digastric, and then here's the left digastric. Deep to the digastric, you can see here, this is the myelohyoid muscle. It sort of looks like a fan. It has attachment to the hyoid bone, but also there's this raphe, this like fibrous part in between the two. So the two muscles are attached to the center line, this raphe, and they are also attached to this lower portion of the mandible as well. So this is forming sort of like the bottom, like the bottom of your mouth here. Deep to this, and it's not shown here, unfortunately, in this picture, but there's one more muscle that's deep to this. It's the geniohyoid muscle. So it starts here. It's attached to the point of your chin as well and comes to the hyoid bone, and it's two of them. So there's one on here and then one here. Let's see, what else is important here? You also have your stylohyoid muscle here and here. So the stylohyoid muscle, it's attached to your mandible and it goes back and then also attaches to the styloid process, which is this bone that comes out of your skull and looks like a point. So the stylohyoid, so stylo for the styloid process and then hyoid for the hyoid bone. So those are your suprahyoid muscles. For your infrahyoid muscles, so these are the muscles, the nickname for them is your strap muscles, because they look like the strap that a barber used to use for sharpening their blades for like shaving. So these are your strap muscles, that's their nickname. But their actual like group medical name is your infrahyoid muscles, so the muscles that are below the hyoid bone. So again, their names are going to help you with this. So you have a sternohyoid, sterno meaning sternum, and then hyoid for the hyoid bone. So going from the hyoid bone down to the sternum. You have, we already talked about sternocleidomastoid, but that actually doesn't count. What else can we see in here? Sternothyroid. So you can actually, it's not as easy to see, and I have other pictures for this later. But the sternothyroid muscle, it's attached to both the sternum and the thyroid cartilage, which you can see here. So there's two of them. So that's your sternothyroid muscles. Omohyoid is just an oddly named muscle, but you have an anterior belly of a superior belly of omohyoid and an inferior belly of omohyoid. It's another muscle just like digastric where there's a fibrous band here that helps that muscle to take a turn. So superior belly and then inferior belly of the omohyoid muscle. And then, is that all of them? I think that might be all of them for now. Other important structures that I'm going to point out here, here's that transverse cervical nerve that I mentioned before, as well as greater auricular and your supraclavicular nerves. Again, you can see the brachial plexus deep in this area, but also, and I'm going to mention it now because it tends to trip people up. Here's your ansa cervicalis. So remember we had an ansa pectoralis in the upper limb. We also have an ansa cervicalis. So an ansa just means we're making a loop of nerves. So you can see here how the nerve is coming down and then looping back up. The ansa cervicalis has nerves that come from roots C2, C3, and C4, I believe. So this loop here, this loop of nerves is your ansa cervicalis. And you can see how here it's resting on, I believe this is your internal jugular vein. I think it's your internal jugular vein. But yeah, so here's your ansa cervicalis. Okay. All right. Again, your carotid sheath. Oh yes, it rests on top of the carotid sheath. That's what the ansa rests on top of. So here's your ansa cervicalis resting on top of your carotid sheath. And remember, your carotid sheath is going to have your common carotid artery as well as your internal carotid artery, your internal IJV, internal jugular vein, and your vagus nerve. And another structure that you can see here, since they're like trimming away and we're going deeper, now you can really see that sternothyroid muscle really well. So here's the muscle attached to the thyroid cartilage, and then here's the muscle coming down to the sternum. You can also see your thyrohyoid muscle. So thyro for the thyroid cartilage, and then hyoid for the hyoid bone. So thyrohyoid right here. And what else is important in this picture? So this is your thyroid gland. So even though the thyroid cartilage is up here, the gland itself actually surrounds the trachea. This is the isthmus. It's in about 1/3 of patients, so about 33% of the population has this part coming out of their thyroid gland. Most people just have the H though. And we'll get more into like the thyroid gland later. There's lovely fun topics about the thyroid gland. What else is important here? Actually, I'll just leave that for now. Okay. Boundaries of the posterior and anterior triangles. Okay, so for your triangles, so when you get more into neck triangles, you will have to be pretty particular about knowing your boundaries and knowing what is in each triangle. There are quite a few. So you have two big triangles to start. Here's your anterior triangle, and here's your posterior triangle. For your posterior triangle, it's simpler. So the boundaries for your posterior triangle, you can see here are your sternocleidomastoid muscle, so the posterior border of your SCM, your trapezius muscle, that would be the anterior border of your trapezius muscle, and then your clavicle. So this is your posterior triangle. For your anterior triangle, the boundaries are your sternocleidomastoid muscle, but now the anterior border of your SCM, your mandible, and then an imaginary midline. Now, these are your two big triangles that you'll need to know their borders, but then within each of these is smaller triangles that you're going to learn about later. There's 2 triangles in your posterior triangle, and then 4 triangles in your anterior triangle. And I'm just going to warn you right now, one of the triangles in your anterior triangle has 4 sides. So we're using the term triangle loosely here. Oh, she added animations. That's nice. Okay. And then, so now putting into perspective the triangles of the neck when relating to your fascia layers. So roof of the posterior triangle is the investing layer of the deep cervical fascia versus the floor of the triangle is the muscles covered by the prevertebral layer of the deep investing fascia. So once again, with these areas, we have to know our roof and we have to know our floor. Roof, investing layer of the deep cervical fascia, floor, prevertebral layer of the deep cervical fascia. Roof, floor, roof, floor. Okay. For your anterior triangle, again, well, for here, is it the same? Oh, so the roof is the same, obviously, because it's the outer portion. So the investing layer of your deep cervical fascia again. However, the anterior triangle, oh, now she's talking about contents. Oh, okay, got it. Thyroid gland, larynx and pharynx covered by pretracheal fascia. Okay. Yep, we know we've gone over our carotid sheath, how it has the IJV, the carotid and common carotid artery, and our vagus nerve. IJV, common carotid, vagus nerve, and these are lymph nodes, carotid lymph nodes. That's what the green dots are. Okay. Fascia layers of the posterior triangle, which we talked about. So your roof is the investing fascia, and then your floor is the prevertebral. Okay, so now we can better see these cutaneous nerves of the lateral neck. And these nerves are coming directly off, from like the cervical roots. So just like we had nerves that came directly off of C5 for our brachial plexus, we also have nerves that come directly off of like C2 and C3. So you have your lesser occipital nerve. So occipital is this area back here, part of your skull, like one of your skull bones is your occipital bone. So you can see how like that's this bone right here. So the nerves in the area end up having occipital in their name. So this is the lesser occipital nerve versus your greater auricular nerve. You can see it going towards like the front of the ear here. And then your transverse cervical, so literally transversing, like traversing, going across the neck. And then your supraclavicular nerves, so above the clavicle, supraclavicular nerves. And these are for sensory innervation. So whereas before we talked about the platysma being innervated by facial nerve because the platysma is a muscle of facial expression, these nerves here are sensory nerves, so you can like feel when things are touching your neck or feel when things are warm. So this is all about sensation. These nerves are sensory nerves. Okay. Contents within the fascial coverings. Yeah, fascial coverings. All right. So cranial nerve 11, mentioned a couple of times for innervation of your sternocleidomastoid muscle and your trapezius muscle. It travels within the investing fascia as it crosses to the posterior triangle to enter and innervate the trapezius muscle. It is sandwiched between two layers of investing fascia. So this is in your posterior triangle. Oh, so I mentioned it before, your styloid process. This is that styloid process I was talking about. This is a piece of bone that literally is like jutting out from your skull and serves as a point of attachment for your stylohyoid muscle. And other stuff is traveling in this area too. Okay. So again, we can see these different fascial layers. And now we get to talk about like, again, that danger space, because you can see better in this picture, in this sagittal cut, how if you had an infection up here in your throat, it could travel down via this danger space to get into your mediastinum and cause you to have an infection in your chest. So here is that thyroid gland, here's your trachea, your esophagus, and then again, this was your buccopharyngeal fascia, and then your alar, and then your pretracheal. And that danger space is in between. for that traveling of the infection down to get to your mediastinum. I feel like that you can also get infection traveling here as well, but I'm not going to worry about that right now. Mostly I just want you guys to remember like this danger space is where you should worry about traveling of infection down from like your oral cavity, your throat into your mediastinum. Okay, and then again, this is a netter plate that's showing the same thing. So we can see our buccopharyngeal fascia, our alar fascia, our prevertebral fascia, excuse me. And then here we can see our thyroid gland. And so that pretracheal fascia, excuse me, coming along and then going down towards the heart, because this is the actual arch of the aorta here, and here's the rest of your heart. Okay. The pharyngobasilar fascia. Okay, so we're looking posteriorly now. These are the constrictor muscles that help to make up your pharynx, and then the pharyngobasilar fascia. So again, pharynx is your throat, and here's like a cut from your skull. So this must be fascia that is coming down from your skull and helping to create your pharynx here. Unless, oh, got it. Okay, so this is your superior constrictor muscle, and then in the middle, and then inferior muscle. So I'm wondering if this fascia is like surrounding that muscle. I'm not sure. You'll learn more about your constrictor muscles when you get deeper into head and neck. And then this is actually your esophagus down here. Okay. I don't know what she finds important about this picture, so I'm just going to talk about all of it. So here you can see your parotid duct. It's been cut. So your actual parotid gland sits here. It's a pretty big gland. It is your largest salivary gland. And the duct is how saliva gets from the gland into your mouth. The duct pierces through the buccinator muscle. It's like, how do they pronounce it again? The buccinator muscle. So this would be where your parotid gland sits, and then saliva going through the duct and then emptying into your mouth. The buccinator muscle is another muscle of facial expression. And then pharyngomandibular raphe and the superior pharyngeal constrictor muscle. Okay, so I mentioned the superior your superior constrictor muscle for your pharynx. You can see here how it has attachment to this pharyngomandibular raphe. So it's attaching here, and then it's circling around posteriorly to help create that superior portion of your pharynx. And oh, hey, here's, I believe this is the fascia she was talking about in the previous picture. The pharyngobasilar fascia. You can see it better in this picture. This is from Gray's Anatomy textbook, by the way. Yeah. Okay. So lymphatic drainage of the head and neck. There's a couple of different groupings of lymph nodes that you're going to want to know pretty well, just for memorizing the pathway of lymph drainage. So you can see here how I mentioned how this bone back here is your occipital bone. So you also have occipital nodes. So auricular means ear, retro means behind. So your retroauricular nodes, which are back here. They're also known as your mastoid nodes, because the mastoid process, which is another like part of the bone, is back there. So either name will do for those. Your parotid nodes are right by where your parotid gland is. So parotid nodes near where the parotid gland is. I think actually this is on top of the parotid gland. Your submandibular nodes, literally translating to below the mandible. So here are your submandibular nodes. Your submental nodes, so the tip of your chin is like that area is the mental area, so submental nodes. Mental actually means chin, and it got that name because pretty much it's one of those stories that they tell where, you know, Greek philosophers, they would sit around all day thinking, and when they would think, they would put their chin on their hand. So the idea of like thinking, mental, chin on the hand. So that's why that area is like the mental area. So mental and then submental nodes. So tip of the chin, submental nodes on the sides, submandibular here, submental nodes. For your deep cervical nodes, you have the upper nodes and the lower nodes. You can see how the lower nodes are closer to like where the clavicle is. And then you also have superficial cervical nodes. So these two are your deep ones. These are your superficial cervical. And then your jugular lymphatic trunk is here. So you can actually see how this is the meeting of two veins. This was your subclavian vein meeting with your internal jugular vein in order to create your brachiocephalic vein. All right. So again, for lymph nodes, you can see how you have your superficial parotid nodes on top of the parotid gland. Here's those retroauricular nodes, literally translating to behind the ear. Here's your occipital lymph nodes. Let's see, here's your submental nodes versus your submandibular nodes. And then again, your deep cervical nodes. So this picture actually gets more specific with your deep cervical nodes, not just upper and lower, but you have a jugulo-digastric, you have accessory nodes, your infrahyoid nodes, your jugulo-omohyoid nodes, and then your suprascapular nodes. So talking about drainage, they actually color-coded here the areas of the head and scalp and where they drain into. So you can see drainage into your occipital nodes, drainage into your retroauricular nodes, drainage into your parotid nodes here. They're also showing here facial vein. Facial vein becomes important for the spread of infection on your face if you like so there's like questions that'll come up where if a person has a pimple on a certain area, they shouldn't scratch it because that can end up causing infection to travel into like the veins, and then it can get into your brain. You'll learn more about it later, but I'm just putting this kernel in your head for later. But yeah, facial vein is involved in that. Okay. And then just remember the jugulo-omohyoid node. Like it's a big one. There's a Netter plate that shows how it is one of those lymph nodes that serves as a common area of drainage for other lines. So jugulo-omohyoid node. And then again, you can see how that final insertion of the chain of lymph nodes goes into the venous system. So inserting into the veins. All right, so this picture down here, this is the important one. The right side of your body is different from the left side of your body when it comes to lymph drainage. You have 1/4 of your body, 1/4 of lymph fluid draining into this right lymphatic duct. So your right upper limb, your right chest, and the right side of your head and neck all drain into this right lymphatic duct. And again, this is the meeting of your right internal jugular vein and your right subclavian vein to form your brachiocephalic vein. Where they meet is where the right lymphatic duct inserts so that that lymph fluid can return into the venous blood system. Now, contrast that with the left side of your body. This left duct, this one is specifically called the thoracic duct. it gets 75% of the lymph fluid that's draining out of your body. So both lower limbs, along with your left upper limb, left chest, and left side of the head and neck, are draining into this thoracic duct. So you have the right lymphatic duct, and then on the left side is the thoracic duct. The thoracic duct gets 75% of lymph drainage versus the right lymphatic duct just gets 25% of lymph drainage. And just like the right lymphatic duct, the thoracic duct inserts at the meeting of the internal jugular vein and the left subclavian vein, where they form the Brachiocephalic vein. And just as a note, I love this picture because it ends up being like a whole bunch of information all in this one picture. Notice how your left brachiocephalic vein is longer than your right brachiocephalic vein. That's because your left brachiocephalic vein has to travel across your body in order to meet your right brachiocephalic, because when they meet, they form the superior vena cava, and the superior vena cava drains directly into the heart. And it's that right side of the heart that we have venous drainage of blood. So the venous blood enters the heart at the right atria. So the left brachiocephalic has to cross over to the right side in order to make this happen. Okay, lymph nodes in the, I can't read that word, deep cervical fascia. Oh, this is like the same lymph nodes that we had before, just showing you them in relation to the fascia. So our retroauricular, our mastoid, our occipital. Okay, these are labeled differently. Because before this was occipital, this was retroauricular slash mastoid. Go with the other ones.
There's a typo, she told us.
Okay, good. I was like, that's wrong. All right, good. Just gonna skip this one then. All right, so I'll end on this slide because we're at 3:53. Again, here's your jugulo-digastric node. Notice how there are different lymph nodes draining into this one. Here's your jugulo-omohyoid node. This is another one that gets, it is a major, and that is for lines of lymph nodes draining into them. That's why they highlighted these two in red, because they're the big ones. Let's see, and then your anterior cervical versus your posterior lateral superficial cervical, also known as your spinal accessory nodes. So this is just another picture. This one's from the Netter, the Netter plates. That's just showing you the lymph nodes again and the different patterns, like the different ways that they line up and labeling them. So here's our submentals, here's our submandibulars, here's our parotids, the mastoids, the occipitals. So yeah. How many are left? Okay, this is on the posterior side of the neck. So again, here are those three constrictor muscles, superior, middle, and inferior constrictor muscles forming the pharynx. And then you can see here, you have your jugulo-digastric node, your jugulo-omohyoid. So again, this is lymph node drainage on the posterior aspect of the neck. Okay, yeah, and it's 3:55, so I'm gonna stop there. I think we got through most of it. Yeah, we got through most of it. Is there any other big things I want to mention? Oh, drainage from like the tongue. So you're gonna want to know about drainage from the tongue, like the posterior versus the anterior aspect, because I know that comes up as a question. And like the tip of the tongue being drained by submental versus the middle going to submandibular, and the very back going to jugulo-digastric. So the three areas of the tongue and how they drain. And then the rest is like more labeling of lymph nodes and how they drain. So I'm gonna let y'all look at that on your own. I will go ahead and stop sharing and stop the recording now.